something that is most sought after, and the reason women do not dawdle but are happy and excited to see a doctor will be discussed today. Planning a healthier baby? Then you're already looking in the right direction. Today, we will be discussing as to what preconceptional care and counseling is and how you get benefited by it. Hi everyone, welcome back to my channel Womb to Super Womb. I am Dr. Samata with you on this journey towards a healthier you. In my last video, I spoke about what will Womb to Super Womb be all about and the issues that we will be discussing in the upcoming videos. If you haven't watched, please find the link in the description below and do watch. Subscribe to my channel to get more informative videos. Press the like button if you like the content and click the bell icon to get notified first. What is preconceptional care and counseling? When a couple seeks consultation and counseling about pregnancy, its course and outcome before the time of actual conception is preconceptional care and counseling. It is essential for both low risk and high risk pregnancies. In high-risk pregnancies, basically, the risks over benefits of having a baby are assessed and efforts are taken to reduce the perinatal morbidity and mortality. How important is preconceptional care and counseling? This phase is as equally important as the 9 months of pregnancy. Preconceptional care not only benefits the baby but also keeps the expectant mother healthier. It is necessary to make sure a woman enters pregnancy with an optimal state of health, which would be safe for herself and her baby. During pregnancy, her body undergoes profound physical changes, and the body gradually adapts itself to these changes day after day. When the body fails to adapt to these changes, the mother may succumb to ailments, could be minor or major ailments. Hence, with an intent to prepare her body physically and mentally to these changes, preconceptional care and counseling is very, very important. Benefits of preconceptional care and counseling. One of the most important reasons to undergo preconceptional care is to avoid birth defects in the baby. It helps to overcome minor and major complications in the mother. Say an otherwise healthy woman visits a doctor for preconceptional workup, gets accidentally diagnosed with thyroid problem. In such cases, it can be treated beforehand to avoid complications in the baby. Or another case where an epileptic woman visits clinic to get her medications changed so as to prevent untoward complication in the baby without affecting her own health. We can prevent stillbirths or loss of baby before or during birth, premature babies and low birth weight babies. With adequate storage of macro and micronutrients in the to-be mother's body, the baby grows in a healthier womb with all the factors required for its growth and development, and as a result, the baby would have developed good immunity to fight infections after it is born. It reduces the chances of transmission or passing the infection from mother to baby, especially HIV or hepatitis B or sexually transmitted infections. Inherited diseases such as thalassemia or sickle cell anemia can be managed by either eliminating the causal factor or by terminating the affected fetus or the baby sometimes. Not only that, it lowers the risk of diabetes and cardiovascular problems or heart problems later in life. Though pregnancy is an overwhelming experience, it can get troublesome due to psychological factors, especially among teenagers, women planning their first baby, women who have lost babies due to some reasons. They might have constant fear and anxiety. this can be overcome with proper counseling. The very next question that pops up in mind is it necessary to all? Let us consider three categories of women. Firstly, in women planning their first pregnancy. Conditions like high blood pressure are more likely to develop in these women due to exposure to the placenta for the first time. Second, in women planning subsequent pregnancies. Due to relatively older age, the woman is at high risk to develop gestational diabetes and many other problems. Also, there are high chances of dietary deficiencies caused by previous childbirths and breastfeeding. Some women may have abdominal and pelvic muscle weakness. Third, fear and anxiety to some extent is natural in expectant mothers. Since each one of us undeniably falls in one of these three categories, I strongly recommend every woman to undergo preconceptional care and counseling to create a super womb for your super baby. During pregnancy, the demand for both macro and micronutrients increase by many folds. As such, it is crucial for the body to maintain a healthy depot of these essential nutrients before pregnancy, especially if the woman is in her early or late reproductive age. I will be talking in detail about this in my next video, where I'll give you 5 recommendations that you may benefit from while planning a pregnancy. Please don't forget to subscribe, like, share and comment. Stay healthy and stay tuned. Thank you.